All right, we're live. It's Friday. I'm here with my very good friend, Dr. Blair Milo. So this is Dr. Casey Pride. We're coming at you from the Cone Health Institute in Costa Mesa, California. And of course, the purpose of these conversations is to give you quality health information from a natural health perspective so that you can make better decisions for yourselves and for your families. Because ultimately, the person who's responsible for your health and the health of your kids is you. And I'm excited to bring Dr. Blair on. Dr. Blair is a chiropractic kinesiologist. She graduated from Life University, and we actually practice in the same clinic. She practices at the Cone Health Institute as well, specializing in pregnancy and pediatrics as well, which is one of the reasons I wanted to bring her on, is because that's just something we haven't really had a whole lot of time to talk about. So, Dr. Blair, thanks for making time and coming on.
Hi, thanks, Dr. Casey, for having me. I'm so excited to be here.
Yeah, it's good to have you. And so just start by sharing your background, just how you got into chiropractic. What's your story?
So my story is a little bit long-winded, so hang in there with me. So I am a Georgia girl, born and raised, and I was lucky enough to be raised in a home where my mom had been under chiropractic care since she was a kid, and my grandmother as well had been under chiropractic care for years. So I was raised in a very holistic-minded family. We ate very healthily. My mom was very in the know with, okay, what we need to do, what we don't need to do to make sure that everybody's nice and healthy. We ate all organic, sugar-free, never took any medications or antibiotics growing up. So it was funny growing up with that lifestyle, because my friends later on told me, you know, we never liked coming over to your house because your snack drawer wasn't the best.
That was my house too.
Yeah, it's like no junk, none of the usual junk food culprits you would find in our house. So, and even after my friends would leave, they would come back and tell me, you know, I can't believe that you don't have any sugar ever. Like my mom had this one rule that my brother and I had to ration out our junk food per year. So we were allowed like one box of fruit roll-ups and one box of Gushers per year. So we had to make that last. She never gave in to, please, 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 can we have more? No, it was firm, one box a year. That's all we got. And I'm thankful for it now. So fast forward to high school, I grew up playing 4 sports. Year round, was always busy, always very taxing on my body. And I was fortunate enough to live in a small town in a community where I had multiple chiropractors that offered us free chiropractic care as student athletes. So I took advantage of that. I loved it. I loved getting adjusted. I went multiple times a week, and I am so grateful for those people that gave us that care for free. It wasn't until I saw one of the chiropractors in our hometown who kind of took in our basketball team and mentored us and explained to us muscle testing and the nutritional aspect of chiropractic and our health, and how that can be a huge factor in our athletic performance. She challenged us, you know, to do a weekly food log, write down everything you eat for a week and bring it back, and we'll go over it. We'll see what isn't quite doing you service and what is good, what are good things for you to eat. So I brought mine back, and of course, with the lifestyle and the way I was brought up, I had a little bit more of a clean rap sheet than the rest of my team, and it showed in my performance. You know, I was that kid on the basketball court that played all 4 quarters. I barely got any kind of breaks, and I didn't need it. My teammates and friends called me the Energizer Bunny, just because I was always bouncing off the walls and just never ran out of gas. And I think a big part of that was being under chiropractic care and eating well. And I didn't even realize that until later on in my journey. So fast forward a little bit more to college, you know, everybody's trying to figure out what do you want to do with the rest of your life. And I kind of forgotten my background the first semester in college, forgot how to take care of myself. I was out late hours of the night, not sleeping very much, eating tons of junk food, and my health was suffering. I went to the hospital twice in the first year of school, and I had never really gone to the hospital before. I haven't needed to. And I remember thinking, okay, what is wrong with me? I was in bed for like a fever for a week at a time, and I didn't know what was wrong. And I would go to the hospital, and they would send me home with no answers, just a prescription for high doses of ibuprofen. And they're like, you're fine, just go sleep it off. You'll be fine. So at that point, I realized, okay, I had an interest in the medical profession and healthcare, and I thought I wanted to be a physician's assistant, but I just remember thinking there has to be a better way. There has to be something more you can do to help people here and now, rather than just sending them home and wait for things to get better or wait for things to go away. So at that point, I talked to my parents, I talked to my mom, and she was like, you know what, you should probably go talk to your chiropractor. The chiropractor who was our mentor in high school, Dr. Ramona Warren, she practiced in our hometown, and she's retired now, but back then she was still practicing, and let me come in and shadow. And she was doing all of her applied kinesiology and nutritional testing. And after the first patient, watching her get those people well right in front of my eyes, I saw them transform. I knew that that was the profession that I needed to be in, that chiropractic was for me. The saying goes, you don't choose chiropractic, chiropractic chooses you. And at that moment in time, I knew that that was 100% the case for me, and I never looked back. So I finished my degree at the University of Georgia in nutrition science, and then I went on to Life University in Marietta for chiropractic school, and the rest is history.
I love it. So you work with a lot of parents and a lot of kids, and it's awesome to see, because they always come in and they always walk out just smiling and grinning and laughing. And what really called you to that? What called you to the mamas and the kids?
So I've always loved kids. I've been babysitting since I was 12. And even before that, I grew up going to church every Sunday. And I think it was around the time I was like 10. You had like children's church that you would go to during the service, where they kind of gave you more kid-friendly versions of the scripture. And they cut that off at 10. And at that period of time, I realized that there was a nursery going on right next door. And so I would kind of sneak over into the nursery and play with the babies. And eventually it just got to the point where I was in there every chance I got, just helping out, feeding the babies, holding the babies, just caring for them, supporting them any way I could back as a 10-year-old, So kids have always been my happy place. They are so pure of heart and joy. And I didn't realize that I was going to be working with kids as a chiropractor. I thought, oh, chiropractic, it's mostly just adults. But I realized very quickly that no, it can be for kids too. It can be for people of all ages. Everybody can benefit from seeing a chiropractor. So I've just always known that eventually I would do something that I was called to do. And I really believe that working with kids and moms was that calling.
That's awesome. Yeah, I mean, you raise healthy kids, they become healthy adults. It's a lot easier to do that than to find a broken adult who's injured and has terrible health and try and make repairs. So it's a great focus to have. You work with a lot of pregnant mothers, and why is that necessary? What kind of problems do pregnant women have, and how do you help them?
So, yeah, I get that question a lot, because people are surprised. Oh, you adjust pregnant women? And honestly, yeah, that's one of the huge pivotal points of time, is when your baby is developing inside of you, like that's the first time you can impact their health directly, is by impacting the mom's health. So I used a technique called the Webster technique. That's specifically for pregnant women. It was developed by Dr. Larry Webster. He was a chiropractor, and the very first thing that he noticed when delivering this adjustment to pregnant women was that their breech babies, which is when their head is up, so ideally with birth, the baby's head is down near the vaginal canal. So he noticed that after getting an adjustment, if babies were head up, they flipped to head down quickly after the adjustment, which allows for quicker, safer, easier births when that baby is able to move on its own. So basically what the Webster technique does, we're not actually adjusting the baby, we're adjusting the mom's pelvis. So we're bringing balance back to that pelvis. So we're looking at the ligaments, the muscles, the bones, everything surrounding that area where the baby's supposed to come into this world. And a lot of times, due to a lot of different forces that are happening throughout pregnancy, lots of changes are happening in that period of time very quickly, sometimes for moms, and it can be overwhelming to their bodies. It creates torsion. And the best way to describe it is like, okay, so say a bone is out of place for a mom, and it distorts the space that the baby is in inside of her womb. So if there's a restriction or a torsion or there's tension somewhere, it's like a bed sheet. So say you're laying in bed next to somebody and you're under the sheet and they're on top of the sheet. So the person on top of the sheet is creating more tension, making it harder for you to roll over and move around, right? So it's the same way in the womb for the baby. The more tension, the harder it is for them to move around. And a big part of labor and delivery is the baby's natural reflexes guiding them, pushing them out into the world. So by relieving that tension, by balancing all of the structure in the pelvis, restores the mom's ability to create that space for the baby to naturally be able to come in and have a safer, faster, easier childbirth.
Yeah, and the research is pretty clear on that. The pregnant women who are under chiropractic care, their labors are shorter, they're less painful, they're more comfortable. So that's really awesome that you're doing that. Now, once the mother gives birth and now they have this baby, right? A lot of people don't look at babies and think that they need adjustments, but people don't really think about the fact that kids are kind of grabbed by the head, twisted, pulled out, their shoulders are cleared. All these things happen to their structure as soon as they're born. Why do you think kids need it, and what do you tend to see with kids?
So yeah, I get that question a lot too. It's like I always say, my answer is always there's two best times to start under chiropractic care. Number one is at birth, and number two is today. So at birth, there is so much pressure that happens on that baby throughout the childbirthing process, whether it be completely natural, no interventions needed, water birth, home birth, C-section, or a hospital birth that needs some more intervention. There is always some kind of stress on the baby's head and nervous system during that process, because if you think about it, their head is having to fit through a tiny hole. It does expand. The mom's body is pretty amazing when it comes to being able to adapt to that time of birth. But overall, there's always going to be added pressure and force during the birthing process. So there was a study done, actually. I'm going to look at my notes to get these numbers right. But Dr. Viola Fryman, who is an osteopathic doctor, she conducted a study on 1,500 babies within 5 days of birth. And the results that she found was that 10% of babies, just 10%, were perfectly unstressed, had freely movable cranial bones, had no intervention was needed.
Only 10%?
Only 10%.
Wow.
Another 10% had a little bit of cranial pressure, or basically their moves had their muscles and bones in their neck and in their head had some strain. They had been a little bit injured during the birthing process. So those were a little bit more severe. They definitely needed a lot of care, and it took a little bit of time to unwind, but 10% had severe strain and injury after that birth. And then the last 80% had minor strains, but over time, those minor strains, if they're left untreated and undiagnosed, and just people don't even know to check for strain after childbirth, those lead to serious problems down the road, because your nervous system, your brain, and your spinal cord, all of those things developing at a proper rate and without interference affects your body and your system and all of your organs as a whole. So by correcting those things as early as possible, so immediately after birth or even in childhood, it can prevent you from having a bunch of problems down the road in adulthood that could have been prevented all along. So I always refer to it like, kids see dentists at a very young age, and nobody questions that, because, the more proactive you are about your teeth, the healthier you'll be and the less cavities you have. And the same goes for your spine and your nervous system. It's just more of a overall body effect rather than just your mouth. So it's so important to see kids, in my practice, I see a lot of kids with gut imbalances, and they just can't sleep at night. They have a lot of anxiety and stress, and they just have, some of them even have pain as a kid. And it's like, okay, how do we fix that? Chiropractic's the perfect way, because we're able to see, okay, what's going on with you structurally is usually pretty simple as a kid. It's more complex the older you get, but as a kid, things are pretty easy to fix because their bodies are still resilient, they're still developing, and you see pretty incredible results with chiropractic care in children. So I love it. I love getting to treat these kids and see their smiling faces, and have them walk out the door smiling and laughing and loving coming in to see me, because I love seeing them.
That's awesome. I know they love seeing you. And that's awesome, because a lot of parents don't look at these symptoms as really signals from that child's body that, hey, something needs attention. Even
Right.
something as simple as the baby only being willing to latch onto one breast. It's like, that doesn't happen for no reason. Nothing happens for no reason. It's not like one side's chocolate milk, one side's plain, and the baby prefers one side. It probably can't turn its head. There's probably a bone out of position that's keeping it from being able to turn its head, putting stress on the brainstem, putting stress on the nervous system, keeping that baby from functioning at 100%. So, so having someone like you is so good. What's your message to mamas right now? I mean, right now there's so much conflicting information coming to mothers right now. It's so hard to make quality health decisions right now. What advice do you have for them?
So, moms, my heart goes out to you. First of all, y'all are freaking rock stars. I just want you to know that. Especially right now, I am continuously in awe of all the moms that I see with the amazing job that you're doing with your kids. You're not only having to be a mom, but throw in an added juggling role of homeschool parent overnight, and then somehow trying to figure out how to work at the same time, and then just overwhelmed with information and not knowing what to do, what's true, what's not true. And, y'all are trying to make life as normal as possible for your kids right now. And I admire all of the great work that you're doing. Just know that you're seen and you're appreciated. And secondly, more than ever, it's time for us to, come together as a community and as support systems for each other to make sure that we can get through this. I'm going to read a little excerpt from an article in this magazine. It's called Pathways to Family Wellness. So this is a magazine that comes out through the International Chiropractic Pediatric Association every month, or maybe every other month. But a lot of great information in here for moms or people that are just curious about pediatric care and chiropractic care through pregnancy. But this one article talks about a TED Talk by Dr. McGonigal. And she goes on to explain something remarkable about the hormone oxytocin. So I'm going to read this excerpt from this magazine about this love hormone. That's what oxytocin, that's what most people know it as. So it's released when we snuggle with someone we love, and when we play with a pet or friends or other people that we adore. So, but here's what most people don't understand about oxytocin. It's a stress hormone. Your pituitary gland pumps this stuff out as a part of the stress response. It's as much a part of your stress response as the adrenaline that makes your heart pound. So when oxytocin's released in the stress response, it's motivating you to seek support. So your biological stress response is nudging you to tell someone how you feel instead of bottling it up. Your stress response wants to make sure you notice when somebody else in your life is struggling so that you can support each other. When life is difficult, your stress response wants you to be surrounded by people who care about you. So that to me is just telling me, okay, we're all stressed out right now. And that stress response that we feel, all the things that we feel in our body, is our body telling us, okay, we need other people to support us. We need to support other people. We need to give hugs. We need to be there for each other, because as we know it, life is changing, and the only thing that we can do for each other is be there and provide that support system, and just reach out to people that you think you haven't heard from in a while or might need a little extra help, because it takes a village. So just know that I am here for you. If you don't have anybody else that you can think of for support, I would love to give you any support that I can, but just know, moms, that you're not alone.
I love it. Well, Dr. Blair, anytime I talk to someone on here, I love to give you the last word. Whatever you think the world needs to hear from you. What does the world need to hear from Dr. Blair Milo right now?
So I've been trying to figure out what to say leaving this chat with you, but the biggest thing that I want to encourage people to do is take care of the one thing that you do have control of right now, which is your body, your health, and the health of your loved ones. And the best way to do that is do your own research, figure out what it is that you need to do to get yourself healthy and keep yourself that way. And one of the great ways to do that is to come in and see a chiropractor and just be proactive about the things that you can control in your life. With all the unknowns going on, that is one thing that we definitely can keep on doing. So yeah, that's my challenge to you guys. Just take care of your health, take care of yourself, take care of your family, and we're here for you if you need anything.
Boom. I love it. Well, Dr. Blair, thanks for doing this. It's good seeing you, and I'm sure I'll see you in here this afternoon seeing patients. What's that?
I'll see you soon.
Yes, ma'am. And guys, if you find this valuable, I encourage you, share it around, share it with the people who need to hear it, share it with the pregnant moms, share it with the mothers with kids. As you know, censorship is alive and well when it comes to natural health topics. And so if you want this in someone's hands, the best thing you can do right now is send it straight to them or share it on your timeline to help get this information out, because reality is not enough people know this. So appreciate you guys. Dr. Blair, thank you again. And guys, I've got Dr. Liam Schubel coming at 11 o'clock Pacific. It's going to be a great conversation. Looking forward to chatting with him. Dr. Blair, thank you, ma'am.
Thank you. This was great. Thanks, Dr. Casey. See you soon.
All right.